Hello for everyone. Today we will talk about menopausal period. What means menopausal period? Yeah, menopause. Yes, menopause in women. In simple words, if you will tell, any woman has a certain supply of eggs in her ovaries. The ovaries themselves produce female hormones, estrogen and progesterone. It is these hormones that regulate female fertility. Thanks for them, the cycle of ovulation and menstruation occurs. When the egg supply is completely depleted, menstruation stops and the production of these hormones is significantly reduced. Then comes the climax. The climacteric period is a physiological period in a woman's life during which, against the background of an age-related decrease in ovarian function and the complex biological transformation of various functions of the female body occurs. The central nervous system is rebuilt and the activity of the autonomic neural system changes. Evolutionary processes in the reproductive system are characterized by the cessation of first reproductive function and the later menstruation. Here you see types of and another definition, menopause is a physiological period of a woman's life during which the background of age-related change is the body is dominated by evolutional process in reproductive system. Menopause syndrome is a pathological condition found in women in the climacteric period and characterized by neurophysic, vegetative, vascular, and metabolic trophic disorders. Mhm. Next is same definition. Physiological transitional period in a woman's life, which takes a period of time between the reproductive phases and old age. Phases climacteria, menopausal period, from 45 years to menopause. Menopause, the last independent menstruation, is established retrospectively after 12 months of absence of menstruation, age from 45 to 45 years, 55 years, on average 51, 53 years. Perimenopause, the period before menopause and 1 year after menopause. Postmenopause, the period after menopause. Here another definition. Postmenopause, the period following menopause, regardless of whether it came spontaneously, naturally, or was induced, ends at 65, 69 years. It is customary to distinguish earlier and late postmenopause. Earlier means up to 5 years, late from 5 to 10 years, during 5 to 10 years. Premature menopause, cessation of menstruation at age 36, 39 years old. Earlier menopause, cessation of menstruation at the age of 40, 44 years. Types of menopause. Surgical menopause occurs after oophorectomy regardless from the age of the woman. Post-hysterectomy syndrome, a complex of symptoms external in 30-70% of women at various times after hysterectomy with preserved ovaries. Medical and biological perimenopause problems, contraceptions, restoration of fertility, treatment of climacteric syndrome, dysfunctional uterine bleeding, metabolic disorders, oncological disease. Body mass index. Normal body mass index from 80.5 to 24.9. Overweight 25 to 29.9. Obesity more than 30. Premature menopause, cessation of menstruation at the age of 37, 40 years. Early menopause, cessation of menstruation at 40, 45 years old. induced menopause, cessation of menstruation due to surgical removal of birth ovaries after radiation of chemotherapy. In the chronology of the menopause, decreased inhibin B levels, increased activin, decreased levels of progesterone, estrogen, and androgens, increased follicle stimulating hormones and luteinizing hormones level. Menopause syndrome. The presence of symptoms in the climacteric period characterized by vasomotor, emotional, vegetative, or metabolic disorders. You receive vasomotor manifestation, climacteric syndrome in other areas. Classification of climacteric disorders: earlier symptoms, medium term, late metabolic disorders. First group: earlier symptoms. Vasomotors mm, include hot flashes, chills, sweating, headaches, hypertension or hypertension, resting heartbeat, emotional vegetative, irritability, drowsiness, weakness, depression, carelessness. Group 2 medium term urogenital dryness in the vagina, urethral syndrome, urinary incontinence, skin and its appendage, dryness, hair loss, brittle nails, wrinkles. Third group late metabolic disorders, cardiovascular disease, atherosclerosis, postmenopausal osteoporosis, osteoarthritis, Alzheimer's disease. Research methods. Research methods include mammography, examination of breast function, ultrasound examination of the pelvic organs, smear from the cervical canal of the uterus, oncocytology smears, assessment of the lipid spectrum and the blood coagulation system, determination of follicular stimulating hormones level, blood pressure measurement, electrocardiograms, examination of thyroid and liver function, vision test, densitometry, determination of bone density. Indications for specialized consultation. Consultation with the psychotherapists in order to assess physiological and psychosomatic disorders. Examination by therapists in order to assess the possibility of cardiovascular if you have a pre-existing disease. Treatment goals. Our goals include three subsidies: replacement of the hormonal function of the ovaries in women, minimal doses of the drug, improvement of the general condition, prevention of the late metabolic disorders. Hormonal replacement therapy is highly effective and the only pathogenetic justified therapy of climacteric syndrome in peri-postmenopausal women. Estrogen monotherapy is given to women with amputation, extirpation of the uterus, post-surgical condition, yes, um, which means amputation and extirpation. And there are estradiol lavalirate. Estradiol lavalirate, 2 milligrams orally, 1 tablet a day. Intermittent mood, 21 tablet per month. Within 1 year. Estriol 1 or 2 milligrams 1 tablet per day, discontinuous or continuous mode 21 to 28 tablets within 1 year. Next, suppositoriums estriol, cream estriol 1 candle per day or application cream in the vagina. Intermittent mode 21 candle, continuous 28 candles. When symptoms decrease, applications 2 times a week within 1 year. In further according to indications. Next, medicines estradiol gel rub into the skin 1 sachet per day in intermittent mode, 21 sachets continuous 28 sachets within 1 year in further, according to indications. Monotherapy with gestagens is performed in premenopausal women with myoma of the uterus and adenomyosis, which are not surgical treatment, dysfunctional uterine bleeding, and the manifestation climacteric syndrome. Dydrogesterone 10-20 milligrams orally 1 time a day from 5th to 25th day. Menstrual cycle 10-20 milligrams once a day from the 11th day of the cycle for 2 weeks within 1 year, and further on testimony. Levonorgestrel intrauterine system T-bar with container contains 52 milligrams levonorgestrel. Supports selection levonorgestrel into the cavity uterus at level to 20 milligrams. Clarification into the cavity uterus once every 5 years. Progesterone oral 100 milligrams by mouth 3 times a day from 5th to 25th first day of menstrual cycle, 100 milligrams 3 times a day from 16th to 25th days throughout the year. In further on testimony menstrual cycle in vagina 100 milligrams 3 times per day from 5th to 25th day. Combination therapy in a cyclic mode is carried out for women in perimenopause without uterine amputation extirpation. 70 beta estradiol 1 milligrams inside once a day 14 days. Then 70 beta estradiol 2 milligrams and dydrogesterone 10 milligrams orally once a day 14 days 28 tablets per continuous mode 1. 70 beta estradiol 2 milligrams and dydrogesterone 10 milligrams orally once a day 14 days 28 tablets per continuous mode. Next, ways of administration of hormonal replacement therapy: enteral, sublingual, oral, parenteral, percutaneous, Climara, Divigel, Estragel, Vagina, Ovestine, Cream, suppositories, ring, nasal, aerodiol, injectable, Genodian depot, estradiol implant. The mucous membranes of the cervix and the vagina in a postmenopausal woman. Here you see pale, dry, thinned, easily injured urethra, norm urethra, like post-menopause period. Shapes from the change. How does Ovestine work? The normal structure of the mucous membrane of the urogenital tract of a woman. Mucous membrane of the urinary tract of a woman over 50 years old. Cytological picture of the vaginal sip at the initial examination after Ovestine's appointment. Contraindication, absolute and relative. Yes. Contraindications for hormonal replacement therapy: untreated hyperplasia endometry, meteorology of unclear genesis, liver disease in the stage of exservation, arterial thromboembolic disease in the presence or in anamnesis, history. Maybe her father, mother, sisters suffered with thromboembolic disease. Venosus thromboembolia, currently or in anamnesis. Untreated genital tumors, organs, and breasts. Allergy to hormonal replacement therapy ingredients. Not compensated arterial hypertension, breast cancer, and endometry, including a history. skin porphyria, absolute contraindications. Alternative to substitutional hormone therapy in climacteria. Selective estrogen receptors modulator. Phytoestrogens, phytohormones, animal adaptogens. Phytopreparations. Phytoestrogens. Soy isoflavonoids, clopone branched, angelica, Diascorea japans, vitamin E. Phytoestrogens. These are natural substances including in plants and possessing estrogenic and anti-estrogenic actions. Phytoestrogens contain soybeans, lentils, garnet, date fruit, sunflower seeds, grain of wheat, rice, cherry, and apple, garlic, parsley, carrot, green tea, red wine. Postmenopausal osteoporosis. One of the most problems of climacteric periods is postmenopausal osteoporosis. Osteoporosis begins after natural or surgical menopause and it leads to the development of bone fractures 10-15 years after the cessation of ovarian function. Remodeling. The predominance of resorption process over the formation of bone tissue is a natural process after 40 years. Distinguish between women normally, rapidly, and slowly losing bone mass in menopause. Risk factors: nationality, floor, family history, elderly age, late menarche, early menopause, low body weight, amenorrhea, and or oligomenorrhea, anovulation, ovarectomy. These factors preventable. These factors we can prevent, yes. Smoking, alcohol is bad habits. We can avoid these bad habits. Caffeine abuse, sedentary lifestyle, excessive physical activity, intolerance to dairy products, low calcium intake. We must take calcium, increasing taking calcium, vitamin D deficiency. In the morning from 9 to 12 o'clock we must walking, excess meat consumptions. Yes, and at the last I won't say that every woman should understand that menopause is the beginning of a new stage of life, which can be lived as interesting and active as previous years. It is necessary to realize that the time has come to give up bad habits, to exclude smoking and alcohol consumptions. A balanced diet and physiological activity will help in the prevention of osteoporosis and the cardiovascular disease, and the hormone therapy prescribed by a doctor in a rational addition to a healthy lifestyle. Positive attitude, attention to your physical and the mental state is the key to a good quality of life for many years. And we finish our topic. I think everyone understanding a menopausal period climacteric syndrome. Thank you for your attention. See you next lecture.